Hi, another question from our social media platforms. This lady is asking me about hairline lowering procedures. Interesting because she didn't tell me her age, so I'm not gonna assume anything here. I'm not gonna try to guess, but she told me that she's looking for a hairline reduction to reduce the size of her forehead. Hairline reduction procedures are very commonly done. They have some advantages, some disadvantages. One interesting thing that she mentioned in her question is that she had a temporal brow lift 2 months ago. If you don't know what that is incisions are made here in the temples, and then underneath the forehead is pulled back. It's kind of a facelift, but done on the forehead. That is interesting because if she had that done already, I know for a fact that the elasticity that she has remaining on her forehead tissues is not as good for the forehead reduction surgery. I work with a lot of plastic surgeons. I teach at the American Academy of Cosmetic Surgery, so I have a pretty well-rounded background on these facial procedures as they interfere with hair loss treatments too. Very important. If she had a hairline lowering surgery, which basically we cut here, lower the hairline, and bring the forehead up a little bit at the same time, she's going to have trouble probably because the elasticity won't be as good because of her previous procedures. So very important that we get a medical history and a surgical history from every patient, because these little nuances, if they're not detected, they can be a problem. Of course, I would have seen the scars as I examined her scalp, but the question is, hairline lowering procedures can be done. They are done sometimes. Advantages, disadvantages to it, we can talk more in a longer video if you wanted to learn more about it. But for her, there are options. It looks like we can transplant her hairline and do it that way. So it's just a matter of the consultation discussing the options. Thank you.